With Formfit Tracker, pull the strap ends off the brace and fasten them to the strap. Push the patient's affected side hinge out of the brace through the opening on the hinge pocket. Make sure the kneecap is in the middle of the opening. Use fingers to keep the buttress pushed against the side of the kneecap. Pull the bottom strap around the back of their knee to tighten it first, then fasten the bottom strap as the dots show. Repeat for the top strap. The buttress is now in position and pushes tightly against the side of the kneecap. For the unloader 1 with SmartDosing, open upper and lower buckles. Ask patient to sit down and extend leg while fitting the device. Place the device on the patient's leg with the hinge on the affected side of the knee. Align the center of the hinge slightly above the middle of the patella. Center of the hinge should be at the midline of the leg. Place the blue lower buckle button in the blue calf shell keyhole above buckle stability shelf and snap the lower buckle closed. Bend the patient's knee to 80 degrees. Place the yellow upper buckle button into the yellow thigh shell keyhole and snap the upper buckle closed. If needed, adjust the length of the dynamic force system (DFS) straps. Trim back the straps sufficiently so that the alligator clips are positioned away from the popliteal area. Ask the patient to bend the knee with the foot flat on the floor. Turn the upper and then the lower SmartDosing dial clockwise until indicators are in the 5 position. Have the patient stand up and take a few steps to verify correct positioning of the device and tightness of the straps. For the unloader 1, ask the patient to sit down with the leg extended. Have them turn both SmartDosing dials counterclockwise until the indicator is at the 0 position to release tension on the DFS straps. Ask them to bend their knee to 90 degrees and open both lower and upper buckles. Pull the buckle buttons out of keyholes. For Formfit Tracker, have the patient pull the strap ends off the brace and fasten them to the strap as shown by dots. Hold the brace by the hinge pockets, then pull it down to take it off.